Welcome to the Vitalis Health series of video blogs, where Dr. Siobhan Graham is interviewed by Susan Hughes.
So today we were going to talk about stress.
Yep.
I suppose, for example, a typical scenario, I'm sitting in traffic and I'm late for an appointment and there's nothing I can do, it's completely out of my control. But even though I know there's nothing I can do, my heart is still racing, I'm sweating, I'm getting maybe heart palpitations, I'm getting a headache. What is going on there that is affecting my body so much?
There's that fear, I'm late. I know I'm late, the fear of what the person I'm late for is going to think of me, and then that just spirals out of control. And that's that fight or flight.
That's what stress is, basically, isn't it?
And that's kind of the standard reflex mode that most people go into, and with that comes just the increase in your steroid hormones in your body. So your cortisol goes up, your blood pressure goes up because your noradrenaline goes up. So people who are stressed tend to have high blood pressure, and that would be a real reflection of their underlying stress. And they're the symptoms that we feel, but a lot of the time stress, it can be quite insidious, where it's there, low background stress, and we don't have headaches, we don't have high blood pressure, we're not getting flustered or sweaty or palpitations or chest pain, but it's just there in the background, and you maybe have just slightly high blood pressure, and eventually that catches up with you.
Whenever you mentioned cortisol, what do you mean there?
So cortisol is a steroid hormone, and it's produced throughout the day. It's really quite high in the morning time, and that's what gets us up and out in the morning. And then it goes up, and then it just dips down throughout the rest of the day until we're ready to sleep. So in the evening time it should be low, but if you were to go out and get stuck in traffic and get all annoyed that you're late for your first date or a meeting, it's just going to shoot right up again. And so cortisol increases your blood pressure, and we need that to wake us up in the morning and get out of bed.
And a lot of people, panic attacks are like the sort of extreme version of it, but a lot of people do have kind of little heart palpitations or getting tightness in their chest. Is that from stress as well?
Palpitations is sort of like a blanket term for a lot of people, so it can mean extra heartbeats, which are called ectopics, and they're usually harmless, and a lot of us experience those. Some people have them, don't feel them, so if you did electrocardiogram, so a heart trace, then you would pick them up, but the person wouldn't be aware of them, whereas other people are aware that their heart is almost missing a beat. Palpitations to other people is where their heart's going really fast or it's irregular, and that is usually due to something you've taken that's causing that, so medication, alcohol, caffeine, or it could be that you have an extra electrical pathway in the heart. So palpitations is sort of a broad term. When you're anxious or nervous or stressed and you get the odd flicker or flutter, that's usually just an ectopic. But if you're getting it persistently or consistently, and it's lasting for 15 minutes, 20 minutes, then you should get seen by your doctor.
So many people have stress in their lives at the minute in our society. What are the really common symptoms that you see in the clinic?
Somebody could be manipulated in a relationship they can't get out of, male or female, and so they feel a little bit worthless, a little bit useless. They won't sleep, their mood tends to be lower. So stress doesn't really just come on its own, it does affect our mood, it just affects our overall well-being. So your appetite might not be as good, or you may overeat. So I get young men coming in with stress for the first time in their life. They can feel angry as well, so waking up in the morning just feeling generally irritable. And I think it affects all of us. Some of us are genetically more positive people, and you can kind of get over it a bit better. But if you are just somebody that feels that life has dealt you a bad hand, and it may well have, and that is really dominant in your belief of yourself and your life, then the stress tends to affect people like that a bit more.
I was thinking about, I get it now, but my life really isn't as stressful as it was at certain periods of my life. But I remember when I was in school doing my GCSEs, every morning I would just feel like, I suppose, nauseous, and I couldn't eat. Sometimes I couldn't even eat my breakfast. Is there something going on was that because of stress or anxiety that was connected to my digestive system, or what?
Yeah, so I think we're understanding it a bit better now. So it's called the gut-brain axis, or the brain-gut axis. It works both ways. People know it as the anxious bowel or the anxious gut. And I remember having it as well when I worked in the city hospital as a junior doctor, and coming in on the weekends to work. And literally on my way into Belfast, if I was at home in Cookstown, I would sort of feel my stomach just go a little bit, and that was it, in preparation for what this day could hold, you know. And that ancient pathway had purpose, you know, when we lived on planet Earth, when there were real fears and threats of animals, you know, that might attack us, or other people that might, you know, want our food or whatever. But now they don't really have a purpose as such. So the gut thing is probably to do with cortisol as well, to do with the adrenaline, that rush of adrenaline. I don't know exactly the hormones involved in it, but along those lines, where your bowel will either become really active and you have to go to the loo quickly, that's what happens to most people, or it goes the other way and they become constipated as well. So yeah, and that feeling of nausea too, all just related to that release of hormone and adrenaline, noradrenaline.
I was wondering as well about a lot of people have you know, tension in their bodies that they just can't get rid of. It's just there all the time. Could that be caused by stress?
Yeah, I mean, I can sort of speak of this myself. So I had shoulder surgery done a few years ago and had it done again, and it used to stress me out that my shoulder was still sore and that I'd never be able to really surf well again. And when I actually eventually just accepted that my shoulder's not bad, you know, it's not the end of the world that I can't surf, and I improved my posture at the same time, my shoulder just got better. And it was after seeing Michelle, the physio in the building here, that, you know, she was like, "Siobhan, your shoulder's pretty good, it's your posture, it's your back." You know, and I am always telling people about their posture, you know, lift your chest up, keep your head high, tuck your chin. Yet this was something that I could have done a long time ago, like really, really worked on, and maybe it was coincidental, maybe it was just her reassurance, you know. But definitely the muscles hold a lot of tension, and we don't fully understand, you know, from a scientific point of view what that is or why it is, but, you know, the shoulders get tense, the back tenses, and maybe that's a result of just not moving as much when you're stressed. You're trying to be really kind of still, and
it would be great to do another video sometime in the near future looking at stress management, because there are loads of ways to manage your stress, aren't there? But it's a huge area. So
well, I look forward to that soon. Thank you. Thanks so much. Thank you.